in the middle to ask you a question. It will be other way around, if you don't mind.
So we'll exchange roles. Dr. Abri will be a moderator.
So the case is 50 years old, male patient, type 2 diabetes. He had, due to BDR, he had bilateral PRB as well as Avastin injection in the right eye elsewhere. So he presented to me with the right eye decrease in vision for a few weeks and floater in the other eye for a few weeks as well. Clinically, the affected eye, the right eye's vision is low, 0.16, and anti-astigmatic apart from moderate cataract was unremarkable. And fundus exam showed superior TRD involving the fovea with pale disc and active BDR. The left eye showed inferior moderate vitreous hemorrhage, otherwise attached retina with kind of with CME changes, which is approved on the OCT. This is also OCT demonstrating the fovea of TRD in the right eye and epiretinal membrane and mild CME in the left eye. So the management is straightforward for the right eye. So he required combined phaco IOL vitrectomy, BVR membrane peeling, and endolaser PRB retinopexy for the peripheral breaks he developed during the BVR peeling, and silicone all 1000. So the discussion now, his macular status remained the same 6 weeks post-op under silicone oil. What is the next step? Can you go back to the please? Yeah. This is 6 weeks. Yeah.
How would you manage Dr. Singh in such a case?
I think it's more like a residual subretinal fluid rather than macular edema. So this is not very uncommon in TRD surgeries, especially many of us would not drain limited TRDs. So what we do, I think we presented in one of our daily retina meetings also, that we do a raster scan around new vessels and examine the whole area of subretinal fluid, especially at the base of neovascular complexes. Sometimes you will find a tear there. If there is a tear, I would rather go in and aspirate the SRF under oil itself. But if I don't find any tear, then they can they get absorbed over the course of time without any bad impact.
Sure.
So, Dr. Baha?
So
this is under silicone?
This under silicone.
Yes.
Yeah. And
I will inject steroid in
Sorry?
this case. I will inject steroid.
Steroid, Ozurdex. So,
at this time. Okay.
Actually, I agree with Dr. Singh. This is subretinal fluid, and this is a limited residual retinal detachment. And in those cases, it can take up to years to completely flatten. Okay, I would check if there is a break or not. Usually, there is no break, but they take their time. And this will not affect the visual acuity, by the way.
Sure.
I mean, just give it some time. Even sometimes I remove the silicone in those cases, and this also continue to improve.
So, can I carry on just for the sake of time?
yes.
Okay. You want?
I just want, because I have a very similar case.
Sure.
And I removed the silicone and the space collapsed immediately after silicone, like few days after silicone oil and gas. Exactly the same. So under silicone oil, it persists. And after I removed the silicone oil, just vanished this one.
So let's take
let's go, Dr. Abri, with your management.
The sharing the case is to address the second point, injecting medication and with the silicone filled dye. This is the purpose of presenting the case. Totally agree. There is no breaks at the posterior ball. So observation, and this is 3 months post-op. Same situation, function, anatomy, and with the third Dr. Moghazi's point is valid, so continue observation. So around 11 months, the complete resolution of the residual subfoveal fluid because of TRD. CME or swelling macular under oil is not uncommon. We see it up to 42% in the incidence rate, with a variable incidence between, depends on the studies. In TRD in particular, it's logical. You will have residual subfluid, but those with RDs without previous CME, they develop CME post of what you will do for them. So, so in conclusion, the subretinal fluid resolves spontaneously, and this is after oil removal. Functionally is point to vision. My message to the audience basically is you need to confirm what's the cause of the macular edema under silicone filled eye. If it is surgical, like uveitic or inflammatory, you address it by giving steroid, which it could be intravitreal under silicone oil. And you can give anti-VEGF under silicone oil as well. And if it is really persistent because of TRD or there is a kind of missed hole, you go back and reoperate the patient surgically. Conservative approach is basically watch and see, like this case, like TRD, and giving topical NSAIDs might help on those cases. Now, the second question to the panelist is, what are the intravitreal options? And
actually, Dr. Abri, I'm sorry because they are waiting outside our next session.
For the
we are all done with the inside. Not inside. They are after us. So
we'll conclude. Thank you so much. And
thank you for a very nice case. And
yeah.
I would like to thank all our great speakers and panelists for such a great session. I have two announcements by Dr. Al-Amri. The first one is that the group photo will be taken at 1 p.m. On the left side at the booth of the Miyom. The second, that Friday's prayer, Jum'ah prayer, will be outside in the same hotel, just outside the green area. Thank you very much. Thank you.